Hi, everybody. I wanted to come on here and do a video, like a heart to heart, talking about everything aesthetic related when it comes to treatments. So, when you get treatments cosmetically to your face, neck, your body, things of that sort, I hope that during our consultation, we review, all of your goals, um, and whatever your expected results or outcome is going to want to be. I also want you to know, like, I do really have your best interest in mind when I'm creating these plans for you. And sometimes our treatment plans, the course of them can change, and everything doesn't turn out perfect the very first session or your very first time. I have a lot of patients who text me or ask me, like, oh my gosh, is this normal? Or am I going to be swollen? Like, how long is the downtime? I cannot tell you exactly 100% completely how long it's going to take for you to heal. I can give you like a window range, but even though these are minimally invasive, or they say like non-invasive, these treatments still take time to heal. So yes, you are going to bruise. Yes, you're going to swell. There's going to be a lot of swelling for some people. Some people don't swell a lot, and others they never knew, like, oh my God, I'd never swollen like this before in my entire life, because they've never had these treatments before. So it's kind of like you don't know what to expect. But yeah, and then I want you to take in consideration all the risks, because each time that you do a treatment, it's not going to be like your previous experience. So I strive for the best. I don't want to hurt you in any way. I obviously want to help take care of you. I want to make things look better. I want you to feel better about yourself and feel your most confident. But you have to make sure you're in the right headspace and mind space. Anxiety can get high and can take over your thoughts and control your mind, and that's just not healthy, right? And you can kind of get down in this low depressive state. But yeah, I also want you to know, like, when you get these treatments done, make sure that you're not having any important events that are coming around where people are going to point things out and may make you feel, some type of way. I also want you to have a good support system. And if you have some judgmental type of people in your life, then maybe you should avoid them for the next, few days or few weeks, for the month per se. But this goes for everything. This goes for Botox. This goes for fillers, any type of injectables. It goes for microneedling, those heat devices or laser light devices. When you get chemical peels, every person is different. Some people shed more skin than others. And if you're like, whoa, like I can't handle this, then I highly suggest that you reconsider even going through the whole like roller coaster of feelings. Although, like I said, these are minimally invasive, it isn't like surgery. You can still feel soreness, you'll still experience swelling, redness, puffiness, all of that. And there's still those risks, especially with like fillers for ischemia or like vascular occlusion, things of that sort. And I know it sounds really, really scary, but everything in life is scary if you think about it. When you step out of your door, you don't know if you're going to walk into the street and get ran over. You don't know if you're going to get in your car and get into a car accident. So there's always risk to everything. But then in the end of it, there's always benefits too, right? So I really hope that that kind of helps a lot of my patients, or anyone new who's like considering getting these cosmetic treatments. I try not to make it sound so scary, but then sometimes I'm like, it's not always beautiful and pretty. The end results, are pretty significant, and you change and you look different and you look, more beautiful and feel more beautiful. Or we can fix little asymmetries, but I can't strive for perfection. There's always going to be imperfections. with every treatment, anything that you're getting, considering that we are aging still. So this is just, all of these modalities and treatments that we can do in the office is to help you gracefully age, is to kind of pause the clock. But I can't get rid of creases and lines. I'm not ironing anything out. I am not a surgeon, so I'm not pulling, lifting, nothing like that. Fillers don't lift the tissue. All that I'm doing, if you think about an aesthetic provider, is like we're artists and we're sculptors, and we have hyaluronic acid gel fillers that we use as a tool to kind of help mold and sculpt the face back. But if you think about it in reality, you're still going to continue to age. There will still be lines on your face, even though you improve other areas. But I don't want you to have body dysmorphia. I don't want you to continue to look in the mirror every single day and nitpick at every other area that hadn't improved. So be kinder to yourself. Love yourself. I love you guys. Let me know if you have any questions. I can't wait to meet you if we've never met yet and you've been dreaming or wanting to come in for a consultation. But if you have any questions, put them down in the comments below. Continue following me. Sorry, I look a hot mess, or at least I think I probably do, but honestly, I want to show you that there are imperfections. You don't have to hide, conceal, put makeup, do all the crazy stuff. Okay?